Okay, Moto, I'm gonna have some of this patient discharging, okay? You're gonna be one of them pregnant mamas. Aren't you vocal? Okay, you ready? So we have to start with your maternal diet, okay? Adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain adequate hydration. Try to avoid soft drinks, coffee, tea, and any alcoholic beverages, okay? Okay, we want to get you up and moving, so you want to gradually increase your daily activities until you are back to your normal routine, okay? You want to rest frequently. No lifting, pushing, or pulling for the first 2 to 6 weeks, or as instructed by your physician. Do not drive until you are released by your physician, okay? For your breasts, you don't got no breasts, but you do got nipples. For your breasts and nipples, they may have changed or grown in size during your pregnancy. Wear a well-fitted supportive bra, like a sports bra, day and night, and it may be more comfortable as your body adjusts to these changes. You can wear breast pads until your breasts stop leaking. Leaking can occur for several weeks to months, and you may apply ice packs between feedings to ease discomfort. And try to keep them adequately hydrated. So after your breast milk, you can slap some on your titties. Okay? If you're not breastfeeding, try to wear a well-fitted supportive bra like a breast bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborns to suckle to alleviate engorgement. Try cold compresses in the form of a frozen wet towel. You can try cold packs, ice packs, or frozen peas for 15 minutes at a time, every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin, and do not massage or apply heat to the breasts. Any breastfeeding tips? Your baby's mouth should form a tight seal. The lips should be against the areola and not the nipple. If the baby is suckling incorrectly, slide a finger between the baby's lips and your breast to break the suction gently. Reposition and try again. And how long should you nurse? As long as your baby wants to. And that can be usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. It is important for the health of your breast to have your infant feed from both breasts every feeding. Try alternating. Good signs of nursing: hearing your baby swallow without a clicking sound, seeing movement above the baby's ears. The ears may even wiggle, and not seeing dimples in your baby's cheek. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. Hygiene. Wash your hands frequently as you're caring for yourself. Try to prevent infection and always wipe front and back after going to the toilet, and clean your bottom with warm tap water using the period bottle given after your urination or have a bowel movement. It's important you change your pad frequently. Vaginal flow will decrease in amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Try to avoid constipation. You may take a mild laxative or stool softener until bowel movements are returned to your normal pattern. Try increasing fluid and fiber in your diet. Birth control. Discuss birth control options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Sexual activity. Nothing should go into the vagina for the first 6 weeks after discharge. Sexual intercourse may be avoided until bleeding has stopped and the woman feels physically and emotionally ready. Just because you can't have sex doesn't mean you can't do it on the outside. Warning signs to report to your healthcare provider immediately. Some common symptoms: pain, redness, warmth, swelling, drainage, or foul smelling discharge from the incision, or incision begins to open. Discharge from the vagina that has a bad odor, severe headache or blurred vision / visual changes, a temp over 100.4, or you feel kind of cold / feverish, having chills. Any thoughts of harming yourself or the baby, a pain or burning sensation, redness, warmth, or swelling the legs, breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms. Any sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness, or faintness. Crying spells or mood swings that feel out of control, unable to empty your bladder, urination that is painful, difficult, or too frequent, and difficulty having a bowel movement. If your partner, if there's any domestic violence between you and your partner, or any sort of abuse, go ahead and call 1-800-96-ABUSE. For the infant, we're going to try a sleeping position. Try to place your baby on his or her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress in a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. Try avoiding covering the infant's head or overheating. Bulb syringe. Keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe with warm, soapy water after each use and allow it to air dry. Wash your hands prior to handling the baby. Your car seat. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. The use of outdoor announcements is not recommended to announce a birth because they call attention to the presence of a new infant at home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use monitors or commercial devices marketed to reduce the risk of SIDS. Some common behaviors like crying is a normal response to your infant to cry. The most likely cause for crying are hunger, a need for a diaper change, or needing to burp. You should burp your baby after each feed. Some calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin to skin, contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put the baby in a safe place, take a break, call a friend. Sleeping patterns. Your baby requires a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy each day for a supervised tummy time. This will strengthen his or her neck / abdomen. Breastfeeding. Your infant should be breastfeeding 8 to 10 times a day per infant cues. Positioning. Be sure to hold your infant close to you while you're feeding. Your infant needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. If you are formula feeding, your baby is receiving Similac or Enfamil diet. If your baby sleeps in 4 to 5 hours and misses feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. Positioning. Be sure to hold your infant close to you while you're feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. Burping. Infants need to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. Newborn characteristics. Newborn rash is common. It is normal for your infant to develop a rash on their skin. It appears with small red circular areas with white dots in the middle. This does not require treatment and will generally resolve within the first few weeks of life. Avoid lotions, powders, and any perfumed soaps. Melia are pearly white bumps, usually all over the face, especially the nose. They will disappear within the first week of life. Jaundice is common in newborns. Your infant may appear to have a kind of a yellow coloring to their skin. It will start in the face, progress its way down to the toes. If your infant appears more yellow in the first 24 hours, you need to call your healthcare provider immediately. Infant care, bathing. Your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant type soap may be used on your infant's body. Cord care. Keeping the umbilical cord clean and dry, cleanse with warm water and soap when soiled. Inspect the cord surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. Wet and dirty diapers. 1 to 2 wet diapers are normal the first day or 2 days of life. Then you should expect to have 6 to 8 diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow. And with softened inconsistency, your infant should at least have 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. Genitalia. For females, always wipe from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. You want to pat dry the diaper. It is normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. For uncircumcised males, make sure that you wipe them from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and make sure you put a diaper on them. For circumcised males, always wipe the baby from front to back. Be sure to cleanse all the creases and folds to prevent diaper rash. Pat dry and diaper. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and then will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider. The plastic ring method of circumcision does not require a dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider to cleanse the area. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad in plain water. Your dressing. Dress your infant as you would yourself. Avoid overdressing your baby. Too much clothing and too many blankets may cause your baby to become overheated. Lastly, vaccinations. Make sure you follow up with their pediatricians and they should receive all recommended vaccinations.